Right, good evening, everyone. So we are looking to start this webinar literally in the next couple of minutes, and we're going to have a lot of people joining us today. I'm just getting prepared for this, so certainly people are going to start to join us, hopefully in the next 5 or 10 minutes. So get ready, be prepared. We're going to have an absolute great webinar that we're going to be doing today. And essentially, I intend to go through everything that you need to know about becoming a prescriber from start to finish. So that's basically the plan. I'm going to be going through that step by step. So just get prepared for this. We're going to be having an absolute great evening itself. Going to be looking forward to this. So it is going to be amazing. And as I'm speaking, we have people joining us. I have Mahiela, who's joining me now. And literally in the next 10 minutes, I intend to go through everything step by step on how to become a prescriber, how to utilize a prescribing qualification. So really looking forward towards it. It's going to be an absolute great evening itself. Yes. You need the car keys. There you go. You can have the car keys. So we are just waiting for others to join us. So Mihaela, great to have you here. Hello. So hello. Nice of you to join. So it's great to have Mihaela here with us. And we've got others joining us as we're speaking. We've got Blaz here. So literally in the next 10 minutes, I intend to go through everything step by step. And the plan is exactly how do you essentially become a prescriber? And if any of you have any questions that I don't answer, put them on the chat because I am going to go through it step by step. So, get ready, get prepared, because we are going to have an absolute great evening today. So I'm just going to get my good luck pen with me. That is certainly going to be great. So let's have a look who we have joining us. So we have Naheem, we have Mahiela, we have Blaz, we have John, we have Mike, we have Sundas, we have Farzana, we have Kareem, we have Jonathan, we've got Prince. So everyone, great for you to all be here. And literally in the next 10 minutes, as I mentioned to you, we are certainly going to be going through this to start to finish. If you want to start off by introducing yourselves, that's fine. Put your names down, get to know each other. It's very, very important that we do certainly develop this relationship that we have with each other. It's very important that you start to network with each other and get to know each other. So don't use these webinars just focusing on the content that we're delivering, but try to make it an avenue where you can get to know each other, you can network. So certainly introduce yourself. Hello, Rana, nice to have you here. And literally in 9 minutes, I'm intending to go through this step by step with you guys. And I actually feel a bit rusty because I've not delivered a webinar since we had Eid itself. So I'm a bit rusty, which is quite interesting for me because I've not done one for some time. So Uzair, Rana, Naheem, Mahila, Jaya, Blaz, fantastic to have you all here. If you have, for some of you, I couldn't get in touch with you all. If you've got any specific questions that you'd like me to answer, please write them down in the chat. Write them down because it means that I can definitely cover them. But I spoke with close to 150 people yesterday and the day before. And at the end of it, it was very similar questions that you had wanted me to go through. So if there's anything that you want me to cover in depth, write your name down or send me a message privately if you'd like, no problem. I'll go through it. But definitely in the next 8 minutes, I'm going to be breaking this down step by step. Hopefully, the plan is that you will not have any questions outstanding on how to become a pharmacist prescriber, or even if you're a nurse prescriber, how to utilize the skill, and also what pitfalls to be aware of. So just keep that in mind. So any of you got any questions, let me know. Hello, everyone. So hello, everyone. Great to have you all here. And as we're speaking, those numbers are increasing. There's colleagues of mine on YouTube. There's certainly more. And Monica, hello. Loretta, hello. Great to have you here, Loretta. Thank you for taking my call yesterday. Really appreciate that. And as I mentioned, 7-minute time, right from start to finish, I'm going to be going through this. Dimple, fantastic to have you here. Really great to have you here. It was fantastic speaking to you yesterday. You know, it makes this webinar so much more fun when I actually speak to you beforehand, because I can kind of relate to conversations. It's great to have you here. So fantastic. And actual fact, I wonder if Dimple is hey Dimple, can you speak? Are you busy?
Hi, how are you?
Hey Dimple, thank you. Wonderful to have you here. So certainly, you know, do introduce yourself, engage. Any questions you have, write them on the chat. But I'm going to basically go through everything step by step. So, you know, thanks for taking my call yesterday. And I look forward to answering everything today for you. So great to have you here, my friend. Great to have you.
Thank you very much.
Hello, Farouk. Fantastic to have you here. Loretta, again, great to have you here. Dignesh, great to have you here. It's so many new people that I actually, even though I spoke with close to 100 people yesterday, I couldn't get through everyone. So it just goes to show, you know, there's so many of us, and you know, I really want us all to be working together. So let me start to share my screen. Let's kind of really start to get into the nip of things, and we will intend to start in 6 minutes time. So Bismillah ar-Rahman ar-Rahim. Here we go. Right, so good evening, everyone. For those of you who don't know me, my name is Fahim. I'm a pharmacist prescriber, contractor, founder of Medline, and it is absolutely great to have you all here today, because what you folks are giving me today is something that is absolutely priceless. And who can actually guess what makes today so priceless? Go and tell me. Anybody in the chat, tell me what is so priceless that you're giving me today that you can't put a value on it. Who can guess? Any idea from any one of you? What have you given me today that is absolutely priceless? What are you giving me today that, yes, Blaz, Dimple, time. Everything else you can put a price on. Time has no price, because you could be spending time with your family, your parents, your mother, your partners, your children, or whatever you enjoy. Instead, you're here with me today. So I absolutely feel privileged to have this experience with you. I also feel that I have a responsibility or duty to make sure that you have a wonderful evening today. So I need you folks to do one thing. Listen to what I have to say. You do not have to, yeah, Farouk, don't worry, we will be starting at 7. You don't have to, you absolutely don't have to agree with everything I say. Thank you for that, Farouk. So one of your colleagues is saying to start at 7. I will start at 7. I'm very sorry. I won't start before. But I just want to get everyone into the groove of things. And you don't have to agree with everything I say today. Absolutely not. All I want you to do is listen. If there's something you can resonate with or you agree with, take it in. If you can't, in one ear, out of the other ear. Very simple. That's my rules. Very simple rules. Other rules that I have is sometimes, I don't know why, but I get so excited that my laptop gets even more excited and just starts to freeze. I don't know why it's happened, but I've had this happen to me twice in the past 2 years, I think, or 1 year. So if it does happen, just stay on. I will, hopefully it's not going to happen. I will reboot and we'll take it from there. Yeah, Blaz, don't worry. The webinar will be recorded. I will certainly send it to all of you who have missed it. So your colleague is saying that his child is making a mess. His or her, I do apologize. His or her child is making a mess. And no, it will be recorded, don't worry. But if you've got any questions, put it on the chat so I can address it for you. So certainly do that. Okay, we got 3 minutes to go. I'd like you all to at least introduce yourself. Just tell everyone who your name is, brief introduction of what you do. I feel that pharmacists, that we don't connect with each other much. So I'll start off by introducing myself. My name is Fahim. I'm a pharmacist prescriber. I'm also a contractor, and I'm absolutely privileged to have you all here. If you can all just share your names, folks. Get to know each other. Don't use this. This webinar is going to be an opportunity for you to network, for you to get to know each other, build relationships. So definitely in the next 3 minutes, I'm going to be going through. Thank you, Elena. Very appreciate that you made an effort. Hello, Elena. Hello. Very kind of you. So your colleague had, again, Norina, thank you very much for commenting. Mushafia, thank you very much for commenting. Loretta, thank you very much. You know what? This is better, boys. Girl, this is amazing because you're not interacting. And it just makes my life easy as well because I don't get to see you guys. Hello, Usha. Thanks for being here. I don't see you. I have no idea who you are. I've only spoken to some of you on the phone or by email. So it just makes things really good for everyone to engage. So thank you very much for doing this for me. I really appreciate it. And in 2-minute time, we are going to demystify everything that you need to know about non-medical prescribing. I promise you, I'm going to go through it in depth. I've been asked by one of your colleagues to basically to not start till 7 o'clock. So I apparently can't start till 7 o'clock, which is great. Hello, Susan. It's great to have you here. I had a wonderful conversation with Susan yesterday. I hope you don't mind me calling you Susan, because I know some people like call me Sue. Don't call me Susan, call me Sue. But hello, Seema. Thank you very much for you here. Dalvia, thank you. Kiani, thank you. Hey, this is amazing. You people are just so super cool. Okay, so, right, let's start this. So I'm going to start off by just telling you who I am. And my name is Fahim. I'm a pharmacist prescriber. I'm a contractor, so I own a range of pharmacies in Oxford and various other partnerships. And I am the founder of Medline. And for those of you who don't know who Medline is, essentially, I just want to highlight exactly what our vision is. And why I do what I do is because I want all of you guys, you folks, to be the best versions of yourself. That's it. That's exactly what I want. I want you folks to be the best versions of yourself. And I want you folks to have a great evening today. So that is essentially what I want to do. That is why I do these webinars. That is why I do what I do, essentially. So that's kind of what it is. So, you know, I want you to walk away from here thinking, wow, we learned something today. That's my plan. If you ask me what my vision is, you know, we are in the 21st century. And I believe that irrespective of who you are, your age, your gender, your race, your beliefs, in today's world, all of us should have access to great healthcare. And I don't believe that that's a right. I mean, I believe it is a right. I don't think it's a privilege. I think it's a right. I think it's a human right that all of us, doesn't matter where we are, should have access to this. Whether you're in Africa, whether you're in America, India, Palestine, wherever you might be, we should have access to it. And just have a look at what's happening in India. Basic healthcare needs are not being filled. I'm working towards hopefully having a world where that's not a problem anymore. And I want it to be delivered by people like yourself, by people like myself who wake up fulfilled. And some of you might ask me, Fahim, what do you mean by fulfilled? How many of you, if you don't mind me asking this question, have got partners? I've got a partner. My partner, my wife is downstairs. Have most of you got partners? And if you're not partners, maybe you can relate to it. Someone tell me, who's got a partner here? Raise your hand or put yes there. Who's got a partner? Okay, fair enough. What is the difference in telling your partner, I like you versus I love you? Tell me what's the difference. If you tell your wife or tell your husband, hey, I like you, but there's a difference in telling them I love you. What's the difference? Why is it different? And I've done this many times. I went to my wife and I said to her, you know what, I like you. And she looked at me like, what? You just like me? I said, no, sorry, I meant I love you. Do you get the difference? There is a difference in loving what you do, and yes, and being passionate and inspired by what you do. There's a difference in waking up every single day saying, you know what, I love what I do, man. I love everything I do. I love the difference I make to people's lives. I love my job. I love my work, whatever it is. That is what we're working towards. We're getting away from and we're getting away or moving towards you folks waking up every single morning feeling inspired. So just keep that in mind. That is what my vision is. So just a bit about the team. There's myself, there's Dr. Akib, there's Dr. Ben. We have a range of clinicians who work with us. So that's just a brief introduction to our team itself. And the reason why I feel that you are absolutely on the right tracks is because the NHS has a problem. The problem is that there's a shortage of doctors and there's a shortage of nurses. In actual fact, there was a study that was done, and so you folks don't get bored, I'm just going to put that here. There was actually a recent study that was done, and what it showed that there are 2.8 doctors to 1,000 people. That is a big problem. Did you also know that the NHS waiting time has not been hit for over 4 years? Who knows what the NHS hospital waiting time is? Any idea? Usha, you work at hospital, my dear. Tell us, what is the apparent NHS waiting time? I'm sorry, I'm putting you on the spot, my dear, but you work there, so I thought it'll be cool to ask you. What is the NHS waiting time? What is the NHS? By what time should you be seen at the NHS? Any ideas? I mean, if you had a NHS appointment and you went to A&E right now, do you know what the waiting time should be? I'll give you 10 seconds. 10, 9, 8, 7, 6, 5. Yes, thank you. Less than 4 hours. Who's recently been to A&E has had that achieved? I went to A&E a couple of weeks ago, and trust me, it wasn't 4 hours. It was actually more than 4 hours. Some of you might have been fortunate to have that achieved, but the NHS waiting time overall has not been hit for over 4 years. Hasn't been hit. Now, still more than 4 hours. That is a problem. The real problem why that exists, and the real why that's a problem, is because there just are not enough doctors. And this is not a problem that exists just in this country, but exists over the world. So that gives you a very unique opportunity to try to solve this problem. If you solve problems, you will have a demand. I want you to keep this in your mind. If you solve problems, you will have a demand. Just remember that. Keep that thought right there. Okay, let's move on. So you have a clear understanding of what the problem in the NHS is. Now that you understand it, let's move on to the next slide. I just want to briefly talk to you about the prescribing, the kind of how this all happened. Okay, so I'm just going to briefly talk about how this all happened. So first of all, in 1986, what we had is we had this report. And this report basically said that nurses were diagnosing, but doctors were prescribing. Let me repeat it again. A nurse would see a patient, but a doctor would prescribe. Someone tell me what the problem with that is. What is the problem if you were working, let's say, in a pharmacy, and I was a prescriber, and we had John or James or Usha or somebody else was actually doing the diagnosis, but I was writing the prescription. What's the problem? Yes, yes, Hiba, responsibility. So the problem is, who is responsible? The biggest problem is legally who bears the responsibility. And this is the trouble that they had. They said, okay, nurses are on the ground floor. They are seeing patients. They are diagnosing. The doctors are prescribing. This has to stop. Because who's responsible? In 1992, nurses were then allowed to prescribe. They said, actually, nurses were competent in prescribing. Nurses could prescribe. And I want you to really, really, really hone in on this point. Nurses were allowed to prescribe. Remember, your qualification versus a nurse's qualification is different. If you have a look at the learning outcomes for a nurse versus the pharmacist, they are different. Nurses traditionally work very closely with doctors. Nurses traditionally have a very hands-on experience with patients. And nurses traditionally, over a period of time, learn to not only develop their clinical skills in practice, but apply their clinical skills in practice. Pharmacists do not have that same training or the same opportunities. I'll give my example as a community pharmacist. I've only started to palpate, feel, or examine patients in the last 4 to 5 years. Yet I've been qualified for nearly 12, 13 years. Never done it before that. So this course was designed initially for nurses, not for pharmacists. And I'll tell you why that makes sense in a moment. Later on, and when I mean this course, I'm talking about the non-medical prescribing course, the prescribing course that we're discussing today. Then we had the June report, and that said actually possibly other healthcare professionals could also prescribe. And it was in 2002 that we had supplementary prescriber pharmacist, and it was in 2005 that the pharmacist was able to become an IP pharmacist. And I was having a wonderful conversation yesterday with Dimple, who's a pharmacist owner. And he said, look, I've not seen many people actually putting this into practice. And we're talking 2021. And he goes, I've not seen it many. And why is that? And I'll explain that to you in a moment why that is. Why haven't pharmacists been able to put this into practice? Now, I've been quite fortunate that I've managed to put this into practice by setting up my own walk-in clinic, winning multiple awards and so on. And I've been quite fortunate to do this, but not many pharmacists have been able to actually or comfortably say that if they've got a patient, they can safely diagnose and treat. And I'll explain to you why in a moment. So let's first of all go into how do you become a prescriber? How do you become a prescriber? So I had the luxury of actually spending time with you folks, or 100 plus of you folks, to actually go through what you needed to know step by step. So I'm going to go through this step by step, which means that I'm going to be sharing my screen and doing all sorts. So first of all, let's start off by sharing my desktop. Right, can you all confirm that you can actually see my desktop? Anybody tell me that you can confirm that you can see my desktop? Is that correct? Someone just tell me you can see my desktop. Great. Right, fantastic, good, okay. So the first thing you need to do is you need to go onto the GPHC website, and this is literally all I went onto. You'll type in the GPHC website, GPHC, and you'll type in non-medical prescribing. What you'll then come up with is a list of courses here. Can everyone see this tab? Pretty straightforward, right? That's what you're going to click on first, because I went through this and a lot of you had asked this question, what do I do? So I'm going to break it down step by step. You click on this. Okay, I might sound a bit obnoxious here, but yeah, you click on this. And all the courses that you could possibly attend at university end up here. Right, these are all the courses that are accredited by the GPHC. So there's a whole list here. Pretty straightforward. There you go. You've got plenty. You've got plenty of universities that are doing this course. That's what you're going to do first. Now, what I'd like to clarify for you is before you can even consider your non-medical prescribing course, you have to have two things. Two things you have to have in mind. Number one, a DMP or a designated prescribing practitioner. It means the same thing. Before, a DMP stood out for mainly doctors and dentists, but now they've extended it to everyone. They call it a DPP. Pretty straightforward, but that's the first thing that you have to have in place. Now, I'd like to ask some of you here today, and I'm going to just literally put this poll out, and that is, let's have a look here. Right. Let me get my poll up, and here we go. Okay, I want you all to answer this if you can. How many of you have struggled or have tried to find a DMP and struggled? And I think you'll find that more than 90% of you, this is going to be the case. And I'll tell you why this is and how we can certainly go about solving that. Because I know from speaking to you folks that you have tried this. This is not something new. For some of you who haven't tried this yet, you're going to find out soon enough. You're going to find out how difficult it is to find someone to actually do this for you. And we still have some of you to do this. So please, everybody, answer this, because if you answer this, it just makes life a bit easier. But certainly, I'm very confident that 80% plus of you who have attempted will be struggling to find it. So most of you have tried. Come on, we're nearly done. You've got 50. We've got over 100 plus people here. So everyone, just answer that question. Great. We're answering it. Those of you on YouTube who are sat there, you can answer it there as well. So we've got people on YouTube as well. So answer that question on YouTube. We're nearly there. Okay. So we're nearly there, nearly finished. So as you guys are answering this poll, as you guys are working towards answering this poll, which I can move here, and some of you have answered it on the chat, that's the first thing. Now, the reason why you are struggling to find a DMP is two reasons. I'm going to put that in for you now. Number one, COVID. Number two, the PCN pharmacist or GP practice pharmacist. So what's happened now is that, as you probably know yourself, there's a huge drive towards general practice. Around 5-6 years ago plus, it wasn't that difficult to find a doctor to act as your prescriber. It wasn't that hard. Now with COVID, it's become difficult. And with so many pharmacists now working in general practice, and there's a lot of them, there isn't really a need for, how do I put this politely? There isn't really a need for you to act, for someone to act as your designated medical prescriber to take you on. That's the two biggest problems. Number one, because of COVID. I mean, even doctors are actually struggling to sit in with GPs for their training since COVID. Number two, and with the PCN pharmacists, what started to happen is that a lot of pharmacists are now in a GP practice, so they just don't have the manpower, the doctors. Now, there's other theories to this, but I don't want to get into that. I don't want to get into like a political debate here, but these are the two major reasons. Number one, COVID. Number two, if you think about it, years ago, going back 7-8 years ago, there weren't that many pharmacists in general practice. And GPs didn't also know what to expect from pharmacists in general practice. But now it's a lot trickier because there's already pharmacists in general practice. GPs already know what a pharmacist can and can't do. And I think you might know where I'm taking this. So all of a sudden, there isn't a huge drive towards getting you there. That's the problem. So you're probably asking me, well, Fahim, how do we find a DMP? You've got two options. How do you find a DMP? Option number one is what I did. And this was going back 10 years ago, where it's a numbers game, where you are prepared to literally get a list of GPs and email all of them and hope somebody replies back. That is it. And hopefully in your email or when you call them, you've sold yourself enough that they'll be interested. And I'll show you an example of what I wrote in my email. So I'm going to go back to my slide and I'll tell you what I wrote in my email when I did my email. So if I go back here, double click on this, you should be able to see my slide. I just want to show you the email that I wrote down. If I have it here. Oh God, I don't have it here. Okay, great. I've not got it either. But literally what I said to them was, I said to the doctors, I'm happy to train your staff. I am happy to work on discharge summaries. I'm happy to work part-time, and I am also happy to work in your dispensary. So they, in the practice that I went, they had a dispensary, and their dispensary wasn't making too much money. And me being a contractor, there was a synergy there where they thought, okay, if we help him, he can help us. And I made their business profitable. So I gave them something in return. You've got to think, what can I give in return to these practices? If I am going to be wanting to work there, what will I be getting in return? And trust me, just offering money isn't going to work. Just saying, hey, I'll pay you is not good enough, because GPs are too busy. They're thinking, well, even if you do pay us, so what? So you need to think, what can you offer them? So one way would be when you say, I'll train your staff. But remember, GPs want to reduce their workload because there's too much work for them. So if you had the clinical skills training, you would be more, how do I put this? You would be more valuable to them. So I was speaking to Susan yesterday, who runs her asthma clinic with them. This is the kind of thing that you've got to be able to offer them. I can run your diabetes clinics. I can run your asthma clinics. I can run your hypertension clinics. I can train your staff. I can help you with discharge summaries. And you might say, Fahim, if I could do all that, don't you think I'll be working in practice right now? I know it's difficult, but the reality is, but whether you like it or not, somewhere you have to sell yourself. You have to sell yourself. And if any of you have got any suggestions, let your colleagues know. Ultimately, what is the problem with GPs? And GPs have workload. They want help with this. So what could you help them with? You could help them with running their clinics. If you had the clinical skills, you could train their staff to make it more efficient. If you have any understanding of a GP practice, how it works, you could even work toward their QOF points. You could work there as well. You could work on a strategic level to help them with increasing their revenues, setting up private services. They want something in return, folks. Everybody will want something in return. The only time you had a free lunch is when you were in your mother's womb. After that, there is no free lunch. And these tactics are not guaranteeing you success, because it's a lot difficult now. Because there's already pharmacists, prescribers in practices. It's a lot more tricky now. Another way would be that you decide to go on the PCN pathway, and you decide to go enroll in a GP, and you decide to enroll in a CPP, or you become a PCN pharmacist. visit NHS jobs and apply there. Visit NHS jobs, log on there and apply there and go there. But you won't become a prescriber for normally 2 years wait. Normally 2 years wait before you become a prescriber. These are the two options you have, and I'll tell you how we can work with you to solve it for you. I can tell you what you can do so Medline can help you. I can show you how we can help you, but these are the two options you have. Either you do it yourself and you say, no, Fahim, I'm going to be persistent and I'm just going to bombard them with emails. I'm going to sell myself. I'm prepared to work at the end. I don't mean in a bad way, selling yourself, but you're going to give them value. Value is something, think of value like this, right? Imagine, for example, let me tell you value. You're giving me time. In return, you want something from me. You want something from me. You want to learn. You want to learn everything that there is to know about prescribing, right? Otherwise, you wouldn't be here. So this is the exchange that we're having today. It's not necessarily monetary, but there is exchange of value. You feel that actually my time, I'm happy to substitute for this webinar. This is the exchange, and this is the exchange that I've given you. I gave you a proposition. I said, hey guys, I'm doing a webinar today on how to become a prescriber step by step. Attend. You people saw that value proposition and you thought, wait a second, he's teaching me how to become a prescriber. That's going to save me time. That's going to save me money, whatever it might be. I'll attend. In return, you've given me time. In return, I'm teaching you today about how to become a prescriber. I gave you something. You have to give your surgery something. I hope I've given you enough information there for you to think about what has to happen in return. So in terms of finding out the university, I've explained that to you. Very straightforward. In terms of picking a university, I would say if you're going to pick a university, focus on price, how much it's going to cost. And university courses cost between up to 2,000, up to, actually some universities up to 3K. The university course starts up to 3K. And if you ask me, are there any courses better than any other courses? My own opinion is the conversation that I've had, they all have very similar learning outcomes. They all have very similar aims, and I'll go through what they teach you. There isn't much of a difference. I think you should look at cost, look at who you're familiar with, who you've studied with before, look at the distance. And if you are going to go to online learning, what experience they have. Is it online or face-to-face? And in terms of face-to-face itself, the reality is I'll tell you what they teach you and you're going to be shocked. This course is not designed to teach you clinical skills, and I will show you exactly a timetable of what the universities will teach you so you know. This is the criteria you got to think of. Number one, how much is it costing me? Number two, am I familiar with the university? Number three, how far do I have to travel? Number four, is it online? Is it face-to-face? There ain't nothing else that I can think of that you need to consider. Somebody's asked me that I've heard some universities are more difficult to pass than others. That is not the case. They're all very similar in terms of what they do, and I'll go through with you what they do. In terms of finding a DMP or a DPP, if you are looking to have a pharmacist or a nurse act as your prescriber, please make sure that they have experience training and make sure that they're actually doing something in practice. Do not go with a pharmacist. Do not go with a nurse. Do not go with anybody if they've not had experience teaching, or if they cannot demonstrate to you that they're doing this in practice. You are making a big mistake. My own preference is to stick with a doctor or a pharmacist prescriber who's teaching before, has done this before, and is actively seeing patients and so on. Otherwise, do not go for someone who's a rookie. Even if they've been qualified for 2 years, it's a mistake. Teaching is a different ballgame, folks. It's an absolute different ballgame, so keep that in mind. So let's look at the application form. Let's look at the application form, because I've been asked by a lot of my students, we want to go through the application form. If that's what you want to go through, I'll go through it. Fine. Let's go through the application form. A lot of you asked me this question, so we're going to go through it. Where is the application form? First of all, desktop. Right. Hopefully you can all see my desktop. Let's open this up and let's stop the share. Right. And let's have a look. And hopefully you can see my desktop. I really hope you can see my desktop. And I'm going to share this document of, let's end the slideshow. Application form blank. Right. Here is a blank application form. And let me go through this. Yes, the recording will be available. Here is the application form. Right. Okay. Let me go through some key points of the application form. This is an application form. It's all the same. So number one, I want to clarify some points about this application form. and I'm going to go through this. I will answer this question about clinical diploma. I'll go through everything with you. I've got that planned. I've really got that planned. Give me a second. I'll go through clinical diploma in a second because I've got a list of questions that you want me to answer. I will go through it. Let's go through this application form first. So, number one, they're going to ask you what you want to do. Is it advanced professional practice? Is it developing your advanced clinical practice? Is it independent prescriber? Most of you want to go through here. It's just to become a prescriber. Advanced clinical practice and advancing your professional practice, these are separate. So these are different courses. If you just want to gain your prescribing qualification, this is what you want to go with. I just want to get my advanced clinical practice. Sorry, I just want to go with my independent prescribing. That's it. I will go through these courses in a minute. Okay. In terms of your postgraduate diplomas and enhanced, if you've already done some training with university, like you've got a clinical diploma, then you fall under this category. For most of you who are starting out fresh, who've never done any courses since university, this is what it's going to be for you. Just a prescribing qualification. That's all you need for now. And I'll tell you in a second why. Okay, so that's one thing that you have to go through. Number two, easy questions. Have you enrolled before? Are you currently studying with another organization? That's straightforward. This is information about your personal details. Pretty straightforward. This should be easy for you. Then what they go with funding. Most of you will have to select that you're self-funding. So unless you've got funding and you're working in general practice, most of you in community pharmacy will select self-funding, that you have to fund it yourself. If you've got somebody funding it for you, maybe you're working for an organization who's funding it for you, put their details in there. Maybe you're very lucky that your organization is doing it for you. Maybe you're working for a huge organization, put that in there. But for most of you, it's going to be you're self-funding itself. Entry criteria is pretty straightforward. So you need to have your degree qualification. So you've got to have your degree. Doesn't matter what you've got to be qualified for 2 years. 2 years. That's what's going to be important. That's what they're looking for. You're qualified for 2 years. That's what you have to be. I believe at the top of my head, and double check this 2 years is after you finish your pre-reg, but don't quote me on this. I can't remember at the top of my head. If anybody can answer, that'd be great. I believe it's after you've done your pre-reg, but it might not be the case. It might that your pre-reg year actually counts. I'm not 100% sure. So if anybody can answer that question here, that'd be great. Is it somebody has attempted to answer it? And yes, after pre-reg. So it is after pre-reg. I don't know why, for some reason, I was thinking that at some point that's going to be included, but I might be wrong. But at the moment, I've got a hunch that it is after that. So that's what you're going to do. After that, what needs to help, they want to ask is, have you defined your scope of practice? Your scope of practice, and let me clarify this. Oh, perfect. Yeah, 2 years, once qualified, great. Okay, so your scope of practice is going to be where you want to develop your skills for that year. This is not your scope of practice for life. Remember that after you become a prescriber, you are going to be autonomous. You can prescribe in any condition that you feel you are competent in. And we'll get to competency in a moment. You will decide to think about what you want to prescribe in. I would recommend keep it very narrow. So if you're going to do minor illness, decide what minor illness. Do you want to do UTI? Do you want to do ear infections? Do you want to do chest infections? Do you want to do throat infections? If you want to do hypertension, what type of hypertension do you want to do? Stages 1, 2, 3 with no comorbidities. Make it very specific. The harder you make it for yourself, the more difficult it's going to be getting through this qualification. Trust me. You are learning. After this qualification, you can develop your skills and prescribe in anything you want. Do not make it difficult. If I was going to do it, I would pick something that I'm going to see. For example, UTI. I see this regularly. In a pharmacy, for example, I can start to learn about this. So I'll do a UTI. I want to do a UTI that is uncomplicated. So I don't want males. I don't want pregnancy. I don't want children. I don't want with catheters. I don't want any sort of regular UTIs. I want a very simple UTI that uncomplicated. That's what I want to practice in for this 6 months. After this, I understand that I can go on to learn and prescribe in whatever I want, but I don't want to make it complicated myself. Also, find out, is this an area that you enjoy? Do you enjoy this particular area? And are you going to have access to patients? Because remember, with your doctor, it's only 90 hours. That's it. 90 hours is nothing. 90 hours flies like this. You're spending an hour with me. 90 hours is gone. So 90 hours is very, very straightforward. It's little time. So you need to have access to patients that you're going to have. So that's the scope of practice briefly mentioning there. Then what you need to do is you need to be able to have somebody sponsor you or fund you. So you need to have your prescribing organization, whether it's an independent, whether it's a private organization, you need to have someone on your line manager who's willing to support you. You cannot be working as a locum and just apply for a non-medical prescribing qualification and have no supporting organization. They won't allow you to do it. They want somewhere that can support you. So you need to be working somewhere, not regularly, but you need someone who's willing to support you. Someone who's willing to support you. Any manager, you don't have to be, you can just be, if you're a business owner, that's fine. If you're a business owner, then you will certainly have to have someone who can support you. And it might be that you can have maybe you have a manager that works within your organization. Maybe you have a manager who can support you. So just because you're the business owner doesn't mean that you don't have a manager in your pharmacy. So for example, in mine, I've got a dispensary manager. My dispensary manager can support me. It's not a problem. Just someone to support you. So my dispensary manager can support me. Somebody to support you. Okay. If you're a locum, it doesn't mean that you have to start working full-time with someone, but maybe you might have someone that you work with a bit more regular, or you've got a good relationship with someone who's willing to support you. You've got to be having these conversations. So that's just a bit of information about that. Now, once you've done that, it's straightforward after that. Again, your manager, that they're willing to support you. There's the information about your practice organization, who you're going to work with. Again, they're going to want to know this. After you've done that, they're just an easy form to fill out, your DPP or your prescribing practitioner's details. They're going to want to know that. So without this, you're not moving anywhere, folks. You can fill out all the application you want. Without his details or her details, you're not moving anywhere. Then there has to be some sort of agreement in place. How do you get in touch with someone who's willing to be a DPP? What do you mean, Alicia? How do you get in touch? As I mentioned to you, I mentioned that before. If you joined a bit late, you have to email all these practices, or I can tell you how we can support you. You've got to email all these practices, tell them how you're going to give value. We've discussed that. So I've discussed that in depth, how you're going to do that. Maybe one of your colleagues can write it in the chat and put it on there for you, or you can go through the recording. But essentially, you've got to go and have a look at all those doctors, send them an email that I want to do this and give them something in return. And I've addressed this in depth already. So you can rewatch the video and we can go through that. So once you've done that, once you've done all this, you have to then have a personal statement. They want a personal statement. They want to know why do you want to become a prescriber in the first place? Why should we let you on the course? What are you going to do with your course? Are you prepared to study at level 7? So that's what they want to know here. They want to know that information about that there. Again, 500 words outlining your clinical readiness to undertake. So this is all about what professional development you've done, how you're going to prepare for the course, what's your scope of practice, why you're going to want to do it. So they want all this information. They want to know why, because there's a lot of competition. And afterwards, it's to do with your prescribing organization. The rest is easy. So there's the 3 main things. Number 1, supporting. So let's move this here. So number 1, what you need to do is you need a DPP or DMP. And how you're going to do this, either yourself, where you will send emails and contact surgeries with a value proposition. That's the truth. Number 2, a organization willing to support. So with locums, you need to find somewhere where you work regular, or an organization that says that's fine, even if you're working 1-2 a week, we can help you throughout the 6 months, or a manager. And then you need to be qualified for 2 years plus, and you need to prepare a personal statement and choose your scope of practice. And I've already discussed your scope of practice. Please keep it narrow. Do not be Superman. I've made that mistake before. You want to be Superman, you're not getting through this course. Keep it narrow, develop your skills. You can do it after this. What do you mean? What do they mean by those who don't have a first degree? Yeah, hospital consultant would be fine, no problem. But remember to pick someone. So the question is, for those of you who don't have a first degree, what's the question? Where's the question? Something about the first degree. There was something here about a first degree. Where's it gone? Okay, so this is about 7A, to be completed by those who do not have a first degree. The reality is, I'm not entirely sure what that actually means or why they're asking that, but they will certainly want a personal statement with or without a first degree. I'm not entirely too sure what that actually means if you don't have a first degree. I don't think that means first class. I don't know exactly, but it's to do with you will need to definitely have this. I'm not sure what that exactly means, what it means by you don't have a first degree, because all of you are going to have a first degree. So to be completed by those who do not have a first degree. I'm not entirely too sure why they've put that there, but you need to do a personal statement. So just ignore that, why that is. But if any of you, yeah, okay, yeah, I think it's to do with if you have done, I think it might be a clinical diploma, possibly. I believe it might be that if you've got a clinical diploma, you don't have to do this with the university. But for those of you who are basically moving towards, so put it this way, if you're a pharmacist and the only qualification you've done recently is your your university course, you need a personal statement. If you're already on a course like a clinical diploma, then you not naturally can move on without a personal statement because they already have this. So Usha mentioned a good point. So for you people, it's simple. If you don't have a clinical diploma, or if you don't have, or you're not on a pathway, on a clinical prescribing pathway through anything, you need a personal statement. Simple as that. You'll need a personal statement. Very easily put. So you don't have to do it. So that should be fine. So if you're can a GP training be a DPP? I don't think a GP training can. It needs to be a qualified GP or a qualified pharmacist who's been registered for more than 2 years prescribing. So keep that in mind, that it's going to have to be that. So that being said, let's move on further. So we've gone through this. Okay, so we've gone through the application. That's fine. Let's go back to our slide and let's keep working through this. Let's keep working through this because I'm conscious that I want to finish this. I don't want to end up spending too much time on this because we've got a lot to go through. So let's go through this. Right. Okay. So let's move back a minute and let's go through. Okay. So we've talked a bit about finding a university. We've talked about filling out the application. We've talked about a DMP. Let me tell you what you're going to expect on the course. Right. Please remember, this course is not designed to teach you clinical skills. Let me repeat that again. Your non-medical prescribing course is not designed to teach you clinical skills. Do not fall for that mistake. Neither is a clinical diploma designed to teach you clinical skills. That is a separate course you have to do. That is why they started to introduce advanced clinical practice. Clinical skills are not taught by any of those two skills. If you are looking to do a clinical diploma and you think at the end of my clinical diploma, I will be able to diagnose, manage, and treat disease, that is not the case. That is not the case. So keep that in mind. Keep that in mind. Thank you, Susan. Keep that in mind, that these courses are not designed to teach you clinical skills. And let me demonstrate to you what you can expect from a university course itself. Let me show you what you can expect from university course itself. Exactly. So what do you learn? Let me tell you what you're going to learn in a moment. I'll tell you what you're going to learn. You are getting a prescribing qualification out of this course. That's exactly what you're getting out of this. So I'm going to show you what you're going to learn, because here you go. Let me show you what you're going to learn. And you're going to be like, really? Here is a timetable from a university that I will show you. Right. Have a look at this. Can you all see this? Can you all see this, please? A university timetable. I just want to clarify, and someone put it on the chat, please, that you can see university timetable. Right. I'm going to get yeses. Great. Okay. Number one, what they're teaching you, remember that you are being paired with nurses here. It's not for pharmacists. Number one, you are being taught pharmacokinetics. You are being taught pharmacodynamics. Something that I believe most of you would have learned this at university. That is what you're being taught. Number two, what are you being taught? Let's go through this. You are being taught more pharmacodynamics. And you're being taught about adverse drug reactions. And you're being taught more about adverse drug reactions. Guess what? You then have a numeracy mock. And you then have some assignments that you have to do. You then will be taught a bit about prescribing for special groups, and that's only one lecture. And it's self-directed. Then what will happen is you will have some more about pharmacology. You also have to finish off your practice-based log, your competency framework, and a numeracy exam. You have more pharmacology. You have more pharmacology. And then you have a class on respiratory. And then you have endocrine pharmacology. And then afterwards you have an exam. And that is it. Someone tell me, has anything been mentioned about teaching you how to diagnose, manage, and treat disease? So this course is not designed to teach you clinical skills. You will not come out learning how to diagnose and treat. So you've got clinical, the central nervous system. You have pharmacology. You have another numeracy exam. You have how to write a prescription. Pretty cool. You've got prescription writing. You've got a mock OSCE, and you've got some more complementary therapies. And then what you have is you then have some more assignments that you have to do. You then have an OSCE, some more pharmacology, some legal aspects, some bit about clinical governance, and then you have a research opportunity. So they're not teaching you diagnosis, management, treatment of disease. They're not teaching you this. Okay? Yes, there is a destination. I never said it's awful, Manju. I didn't say anything. It's not awful. The reason I say that because the course is not designed to teach you clinical skills. It's not the university's fault. This course is designed for those people. Remember, I gave you the history on nurses. This was originally designed for nurses. This was designed for nurses who had already the clinical skills and so on. What practical skills will they be teaching us? Well, I'll leave you to answer that question. I'm not really too sure what practical skills they're teaching you. And if they do teach you practical skills, mandatory classes are anywhere between 8 to 12 classes are mandatory. 8 to 12, that's it. Out of the 6 months, 8 to 12 classes are mandatory. 8 to 12 classes are mandatory. So write this down. 8 to 12 classes are mandatory. You will have OSCEs at the end on how to take a history, 2 or 3 examinations, online these days. Everything seems to be online these days, okay? You will also have to do an assignment, an essay. You have to write an essay. You also have to pass an exam. So let me write this down. Let's write this down. Number 1, 8 to 12 study days, mandatory. 2, you will have OSCEs. 3, you'll have a written exam on pharmacology and pharmacokinetics. And you have to do essays, prescribing essays. So you'll have to do a prescribing essay, and you'll have a portfolio that you have to fill out. And I'll go through a portfolio in a second. So let's go through some of these essays. Let me go through some of these essays with you. I know some of you are going to be like, oh my God, essays. Yep, my friends, essays. Let me show you another university, by the way. Let me show you one more. Let me show you one more. Let me share my desktop, and let me show you one more. Let's have a look at this. Let's look at this short timetable here. And again, as you can see, what are we learning? Let's have a look. We've got some introduction to prescribing. We've got some introduction to e-learning. We've got some academic skills on reflection. We've got supervision groups. We've got some skills for pharmacists here. No, you're not exempt from this course itself. You still have to go through it. Literature search, you're going to have to do, hey, look at this, pharmacology, pharmacodynamics, pharmacology, pharmacodynamics, pharmacology. Great. You're going to learn about consultation models. So you learn about some models. You then have to read this book on an OSCE. That'll be given as well. So there's some OSCE stuff there as well that you'll have to do. Remember, this course is not designed to teach you clinical skills in the first place. So it's not the course. Clinical management plans, pharmacodynamics, pharmacology, again, introduction to public health. You get the point, right? There isn't anything that's teaching you anatomy, physiology, pathology, how to diagnose, manage, and treat disease. There's nothing here. There's nothing here. It's not designed to teach you that. Remember, the course is only 6 months. It's not designed to teach you this. So just remember that if you think that at the end of this, that you're going to be diagnosing, managing, and treating, you're making a mistake. You won't be. That I can put my hands down and tell you that now. Here's the one that I don't want to show you, portfolio. So you have to log your hours down. For example, you have to log your hours down like this. This is like a portfolio here. So you have to write your hours down here, for example. You will, like what you did with your DMP, this is part of your portfolio. So this is your portfolio on what you did. So I told you I put down what I did and what I observed, what my learning outcomes were. So this is one part of it. The other part of it is the actual OSCE itself. So they'll give you, do you introduce yourself? Do you identify? Can you take a thorough history properly? And they'll give you this. You'll also have to do some reflection. Then what you'll have to do is your competency framework, and you'll have to fill this out, show how you map yourself across the competency framework, and you'll have to show them, and then you have to get your doctor to sign this. So this has to happen as well, that you're gonna have to go through. You know, it's not stressful, but it can be challenging because people don't get stuck with this because they go to university, they're not studied for ages, it really becomes kind of messed up. Then what ends up happening is then you have to, again, do a verification of practice, and then you basically, that's it. So I make it sound like that's it, but that's basically what you're going to have to go through. I want to show you an essay that I wanted to show you as well that I did. So you'll have to write these essays as well. There's a lot of academic stuff, folks, that you're going to have to go through, whether you like it or not. So for those of you who have not done academic work before, you haven't done referencing, unfortunately, you're going to have to do this again. So let me open this up and let me show you my oh God, I don't have, oh, there's my prescribing essay. Oh, I don't have my prescribing essay here. I thought I had it, but it's messing around somewhere. But you have to write, like I did, 5,000, I think it's something like a 5,000 word essay or something you have to do. You're going to have to do some form of essay writing. They will certainly have that there. And I'll summarize everything, but let's keep moving on because that's quite a lot. Now, you might wonder after all this, why should I even become a prescriber? Well, number one, if you do it the way I'm telling you, and I'll tell you how to do it properly, there's a lot of benefits for this, okay? Number one, yes, some of those topics are covered in your clinical diploma, but you'll just have to, I guess, redo them again. So why you should do it? Number one, you can make a difference to people's lives if you can utilize this skill. Imagine waking up, helping patients, diagnosing, treating. It takes you to the next level. Believe me, it is a wonderful experience if you can use the skill. Number two, if you're a business owner or you're thinking about business, you now have a tool that you can use to solve problems. Number three, if you're working in general practice or you want to work in a GP practice and you've got the skill and you can use it, you can increase your salary. You can increase your salary. So that's another thing. It doesn't matter where you've done your pre-reg, doesn't make a difference at all. Understanding the human body is a lot more complex. It doesn't matter if you worked in hospital, it doesn't matter if you worked in a pre-reg community. This is a totally different ball game because you wouldn't have come across this, and I'll go through this in a moment. So not only can you make a difference to people's lives, but you can benefit financially because your salary would increase if you can. Remember, let me ask you a question. If you came to work in a GP practice and you said, look, I can take a caseload off you, this is where your salary starts to increase, when you can solve problems. If you're going to work for anybody and you can't solve problems, they're not going to increase your salary. Get this in your head. If you cannot give people value, ain't no one going to increase your salary. It's not going to happen, whether you like it or not. Just imagine you come to me, right? And you say, I'm a pharmacist prescriber. Okay, and what? Can you diagnose and treat, manage people? No. So why would I increase your salary? What problem are you solving? Keep that in mind. If you cannot solve problems and you can't diagnose and manage and treat with this qualification, no one's increasing your salary. So if you can do that, then people are interested. If you can't do that, you're not. Just have a look at NHS jobs and have a look at the average salary. Who can tell me what the average salary for a pharmacist in a GP practice? Tell me what the salary is. Who knows? Hourly rate. Do you think you're getting paid 60 quid an hour? So the average rate, someone is saying 50,000 to 45,000 pound an hour. Usha's absolutely right. You're looking at it very varies. It can vary depending on your skill set. So if you can use your skill set, then you're going to be anywhere between 40 plus. If you can't use your skill set, you are not going to be on 35, 40 pound an hour. I have seen rates up to 25 pound an hour, if not slightly less. If you're trained and you can use your skill set, then you're going to get paid those rates. Otherwise, you're not. Why? Even if you did land a job for 50K, 50,000 pound a year, and you can't do the role, do you think you'll be in that job for that long? Think about it. Imagine you're in this place where they're saying we'll pay you 50, 60K a year. And you have to be able to run your asthma clinics, hypertension clinics, diabetes clinics, do X, Y, Z, and you can't. Do you think you'll have a job for long? By the way, that's a rhetorical question, so don't answer it. You're not supposed to answer that question. You're not. You're not. Because once they do your annual reviews, they're going to say, actually, you're not really doing much for us. You're going to struggle. So keep that in mind. Once you can use the skill, you can. I have seen people get upwards, including myself. I have seen people getting upwards of 60 pound an hour if you can use a skill set. So the next question is, what are the pitfalls? One of the pitfalls that you folks are going to make is you folks are going to be like, okay, I'm going to start to find my own DMP. There's nothing wrong with it, but it's time. Pitfall number one is you will try to find your own DMP and you will apply 1,000 places and you may not get any results. No harm in that. But the reason why you haven't got results, you're not offering anything in return. Number two, you will think at the end of this course, I can do what Fahim is doing. I can set up my private clinic. I can diagnose, manage, and treat diseases. I'll be doing everything that's taken him a certain amount of time to do. I'll do it in 6 months. It's not happened. It's not going to happen. And it's not because you're not capable, it's because the course isn't designed to do that. That's another mistake that you're going to make. These are the two biggest mistakes that I find students make. And then they come to us and say, look, can you help us? Is they can't find their doctor and they waste a lot of time. And at the end of the course, they realize, actually, this course isn't designed to teach me anything. It's designed to give me a qualification, but that doesn't mean I'm competent. These are the two biggest pitfalls that you're going to make. Also, what you're going to be thinking is actually that once I become a prescriber, magically my salary would increase. No, it's not. So keep that in mind. These are two pitfalls, and it's not your fault. It's because people don't tell you this about the course itself. They don't tell you this. This is another problem that you might find. If you do decide to be brave, then that's where you can land yourself. This is where you can land yourself. And these trials, does anybody know why the, not NPA insurance, why the, who's the other insurance providers? NPA, what's the one that does pharmacists? Who are they called? I can't remember, I've gone blank. Who's the other insurance providers for GP practices and so on? Everyone should know. Who are they? Who can tell me? I can't remember, I've just gone blank. Yeah, PDA. Why have the PDA now become so cautious in who they give their insurance and who they don't give the insurance to? Because of this. Pharmacists have gone on without the training, are doing high-risk tasks, are doing things that they're not trained to do, and they land themselves in trouble. Who's seen this happen? Who's seen pharmacists signing off methadone prescriptions, signing off prescriptions in a GP practice, and they don't have the training? Who's seen this happen? I've seen it. I see it all the time. And, oh, it's okay, nothing will happen. That's true. Nothing happens, something goes wrong. Which one of you seen this happen in practice? Thank you, Susan. I'm very happy daily. Susan works in a GP practice. She will tell you happens all the time. Things are good until they go wrong. Let me tell you that right now. Everything is good till it goes wrong. And tell me something. If I was a doctor and I asked you to sign something and something was to go wrong, do you really think that I'm going to say, you know what, it was my fault? Or do you think that my license is comfortable to me? Do you think that I'm going to stand up and say, hey, actually, I forced for him to do it? Or do you think I'm going to say, you're a prescriber, you should be working autonomously. Why did you do it? You tell me, what would you do? I can only encourage you. I didn't force you to do it. Why did you sign? It's your license. Everybody wants their number. So is there a lot of pressure? There's a lot of pressure for pharmacists to prescribe out of their competency, because that's what, if you have a look at literature, that's what a lot of clinicians have been sold. A lot of clinicians have been sold, and I did a webinar on pharmacists working in general practice. A lot of clinicians and GPs have been sold that you can do everything. When they think of a pharmacist, that's what they've been sold. That you know, we're hiring you, we're getting paid, you should be able, why are we paying you £50,000 a year? If you can't do this, get on with it. So it's not entirely your fault, but you need to know, you need to do it properly, develop yourself and invest in yourself. This is the pathway that we have designed at Medline. Number one, we take you on a journey and develop your skills on how to treat the human body. And I was having a wonderful conversation yesterday with Susan about spirometry, about asthma. And again, you know, it's important for you to understand the relevant anatomy and physiology. Number two, you need to be able to know the general signs, symptoms, diagnosis manager. For every single disease, you have to know this. Let me write this down. Right, you need to know for every single disease, the incidence. How common is the condition? Number two, for every single condition, you need to know what's causing it, etiology. Number three, for every single condition, you have to know how does sex affect it. Let me give an example. If you've got a female patient who presents with lower abdominal pain in the left or right iliac fossa, tell me one differential diagnosis. Tell me one differential diagnosis. If you had a female patient who presents to you, I'll make it easier for you, who's also not had any periods, her periods are late as well. Name me one differential diagnosis. Yeah, pelvic inflammatory disease, but name me another differential diagnosis. Ectopic pregnancy, well done. Do you think an ectopic pregnancy is common in a male? It's a rhetorical question, please don't answer that question. But you need to know how sex can affect diseases. Geography, tell me if you were in India right now and you were working as a clinician and a patient presents to you with shortness of breath, fever, chest pain, what do you think it could be? Thank you very much, COVID. Right, you need to understand how geography affects it. Name me a condition, if you were to go to, name me a condition where if you have hot showers, humid conditions, it can affect your ears. Name me one condition where that's common. If I said to you, I love having hot baths, I do a lot of swimming, I go to hot countries, name me a condition that could cause me an earache because of that. Glue-ear otitis, otitis medium of the, yes, well done, Ab. Otitis externa, correct. Otitis externa, well done. Right, good. Tell me how age can affect the disease. Obviously, that should be straightforward for you as well. The pathology. You need to understand the pathology. You need to understand, for example, let's talk about an ectopic pregnancy. You have to understand, first of all, what does ectopic mean? Who knows what ectopic actually means? What does ectopic mean? I'll give you a count till 5. 5, 4, 3, 2. Yes, correct, Kizzy. It means it's in the wrong place. It means something that's in the wrong place. And you can have many different areas that this can happen. So you will need to understand, where did fertilization happen? So you have to understand the pathology. Where did it happen? Let's think about something like asthma. Who's heard of the new theory that's known as the epithelial trophic unit or the mesenchymal dysfunction? Who's heard? Susan, you're studying asthma. Have you heard of the epithelial mesenchymal trophic unit dysfunction? Epithelial mesenchymal trophic unit dysfunction. Have you heard of this new theory on why you develop asthma? Other than a type 1 hypersensitivity, ever heard of this? If Susan is there. So you need to understand, okay, well, you need to, if you are studying asthma, it'll be a very interesting one. And it's all about how the epithelial lining becomes disturbed. It's a great one, research it. So they're now looking at actually, the asthma isn't just a type 1 hypersensitivity reaction. It's actually a bit more than that. And it's known as the epithelial mesenchymal trophic unit dysfunction. Have a look at that. So you need to know that about your diseases if you're going to start to treat. You need to be up to date with your guidelines. You need to know your macro and micro. I think macro pathology is more important. Then you have to know your signs and symptoms, then the prognosis, then you have to understand your treatments. And let me explain this to you quickly. Right, let's do a quick exercise. Okay, you have a patient, who presents to you with an acute shortness of breath. Somebody name me some differentials, please. Acute shortness of breath, some differentials. Acute shortness of breath. I'd like some differential diagnosis. Somebody tell me. Okay, so we have, right, you've got have an acute exacerbation of asthma, correct? You can have acute exacerbation of COPD, correct? You can have a pulmonary embolism, correct? Yes, you can have AVN. I love the pulmonary embolism. Yes, somebody could be having an MI, correct? Somebody could be having a pneumonia, correct? Could be heart failure, correct? This is exactly how you have to go through every single condition. Name me some differential diagnosis of somebody who presents with right hypochondriac. Okay, let's not use too much classical words. Tell me somebody who's got pain in the right upper quadrant region. So the right upper quadrant region, abdominal pain. So gallstones, what else? That's been mentioned. So liver, gallstones, so cholangitis, cholecystitis, IBS, hepatitis. What else could it be? What else? Yes, technically appendicitis could be a stomach ulcer, correct? What else? So you get the point. You need to understand, not only should you be able to name these conditions, you have to be able to differentiate with these conditions, step by step. How do you differentiate between pancreatitis, appendicitis, gallstones, cholecystitis, cholangitis, cholelithiasis? You have to be able to differentiate with them step by step. Okay, then you need to be seeing these in practice to develop your skills. And you need to be able to take a thorough history. You need to be able to examine all the body systems. You need clinical practice. Then you go on to non-medical prescribing. This is where non-medical prescribing sits in my eyes. This is the mistake that I made. I just went here. That's what I did about 7-8 years ago. I thought I'm going to do my prescribing qualification and hopefully I'll learn everything else. It does not work like this. It does not work like this. So that being said, let me tell you how we can help you. So that, as I mentioned to you, that's our vision. Again, the benefits of doing your prescribing qualification are huge, from inspiring clinicians, bettering life, building a better future, offering solution, and ready for the future. By 2025, pharmacists have to be prescribers. That's the plan. Right. We do a course where we take on our students and we develop them from start to finish. Okay. So this course itself is our non-medical prescribing course. It costs £3,000. It does not include university fees, but we guarantee that we will take on a student. We will organize your prescriber. We will assist you with an application form. We will develop your clinical skills. That includes face-to-face classes. That includes all your body systems. That includes all the disease states, how to manage it, diagnose and treat. We will do that for you. That's the course that we offer over a year. And it works out longer than a year. And Hiba, my colleague or student, is actually on these courses. Some of my students are on these courses. That's what we guarantee. And we also offer a better than money back guarantee. If at the end of it, you said to me, Fahim, I can't use my clinical skills, I can't diagnose and treat disease, you can have your money back. That is how confident we are at Medline. So all your problems, we will solve. We will take on a student and we say, right, let me help you and take you from start to finish. Let me develop your clinical skills so you can diagnose, manage, and treat disease and get your prescribing qualification. I will teach you everything start to finish. That is what we do. Okay, so that's just some of the topics we cover, and that's just huge. So, from the relevant ear anatomy to otitis externa, otitis media, to throat physiology anatomy, tonsillitis, nose anatomy, sinusitis, epistaxis, GI, kidneys, UTIs, gastroenteritis, IBS, from everything about skin's hypersensitivity to, we cover every single condition. And you're not going to cover this in 1 year. It's impossible for you to cover it 1 year, but we basically take our students and take you on a journey. We develop you part of our network and say, right, you're going to work with us. We're going to teach you everything. You want to learn about heart failure? We'll teach you heart failure. You want to learn about hypertension? We'll teach you hypertension. We take it from start to finish. And I'll show you quickly about the platform itself. So you might wonder, how does it all work? So if I go on my desktop and I quickly stop my share, this is essentially how it works. Oh, why am I not able to stop my share? I'm actually getting hungry. I don't know. I don't know what you lot think, but I'm getting a bit hungry. I don't know why. Anyway, here it is. Like I mentioned, you have access to your own e-learning content. And you know what? All our e-learning content is, as you can see, it's all interactive. So this is the pre-learning side of things. This is what helps you with the pre-learning side of things. As you can see, so the location of the ear. Let me show you something cool.
Where is the location of the ear? Where is it located? Now you might say, for him, the ear itself is located at the sides of the head, which is true. But exactly where is it located?
So we can see that we have all interactive content here. So you'll have to look at stuff. I mean, we've spent around, 7-8 years developing all this content, making it all interactive and really engaging for you folks. But essentially, as you can see, we cover the full amount in depth, where you have question slides, you get access to, like, for example, mastoiditis. This is a real life example of patients and what it looks like. So this is your platform where you log on, you have access to your learning, you have access to your mentors. We do face-to-face learning that we cover all your systems. So we basically put you on a structure and covering everything in depth for you. So I just thought I'd briefly mention that to you there. So I'm just going to go through, again, we have over 1,000 students on our courses now. So essentially, that's the main thing there. So you'll have access to all you get access to the various content that you can make your notes and so on. You get access to anything, but let me show you. Let's go through what we've FAQ. So let's quickly go through everything that I've wanted to go through. Which university should I attend? I've told you that depends on where you want to go. All of them will have similar learning outcomes. If you think that you're going to be able to develop your clinical skills, you got that wrong. How shall I fill out? I've explained that to you. The role of a prescribing pharmacist. So a prescribing pharmacist, essentially, in a GP practice, or even in community pharmacy, you will be seeing patients, you will be diagnosing, managing and treating diseases. In a GP practice, it's slightly different. I don't have time to go into that in depth, but I will be doing a webinar on what to expect in a GP practice. But GP practices will be doing the hypertension clinics, doing asthma clinics, where you're seeing patients, doing medicines reviews, doing discharge, slightly different. How to find a DMP, I've been through that. I've explained to you, be very careful. If you are going to use a non-medic to do that, have they got the sufficient training? Can you do this on a part-time basis? Yes, the university courses can be done on a part-time basis because you only have to attend 8 or 12 days. But honestly, it can be quite overwhelming if you're doing it on your own. I'll tell you that now. So if you've got family, if you've got kids and you can't go through it, it can become a bit tricky. If you can study at home and time, yes, you can study at home. You can definitely do online learning. Somebody asked me, is it better to do face-to-face or online? To be honest, nowadays with online, if the content is good, it's all the same, but that's important for you to ask. In terms of cost, up to £3,000 it costs. The future of the profession is that you're moving towards diagnosed, treating and managing disease. If you can't do this now, I can tell you in the future, you're not going to have a job within the next 5 to 6 years. I'm telling you. Why? Because it's going to become common. It's going to become commonplace. So you need to be able to do this. Moving on forward, duration, the course for university is 6 months, but it takes about 8 months to get annotated on the register. How to get a company to sponsor you? You need to speak to the company that you're working for and ask them, would you act as a sponsor? And that's what you're going to have to do. Essentially, that's what's going to be important. So you're going to have to do that. What do you mean, what to do, Manjot? What's your question? Job opportunities, there's plenty of opportunities from setting up your private practice, working online, working GP practice. Advanced clinical practice is a 3-year qualification, and it's a decision for you to make. Do you want to go down the 3-year qualification? Is it mandatory? No, it's not. If you can develop your skills, we can certainly help you with that. It's not a problem. University courses and what to expect. I told you there's going to be essays, there's going to be essays, there's going to be exams, and there's going to be a lot of pharmacology involved. Do I need to be in a community pharmacy, GP practice? No, you don't. You don't need to. I am qualified for 2 years. Okay, so if you're not qualified, that should be I'm not qualified. If you're not qualified for 2 years yet, you should be focusing on developing your clinical skills. That's what you should be doing right now. And then after 2 years, become a prescriber. That is essentially what you should be doing. So you shouldn't be waiting around. You should be getting prepared for this. How to get onto a course, I've told you how to do that. how to find a clinical lead. You need to speak with your prescribing or your mentor or to help you there. How long do you have access to the course? Is it lifetime or just 1 year? So the course itself is £3,000 for the first year. After that, it works out to £30 a month. We want our students to be with us for life. So after the first year, you just pay £30 a month. And what do you get access to? You get access to all the e-learning teaching. You get access to the live webinars that we do with our doctors. You get access to the face-to-face events that we run every month. And you also get access to the DMP training side of things. But most importantly is you will be able to diagnose, manage, and treat disease at the end of the course, and you can use it. So if you wanted to work, if you wanted to work in a GP practice, you can. If you wanted to set up your clinic, you'll have the skills to. It does not include a university course. University are separate. Unfortunately, your university courses will work out to £2,000 up to £3,000. But we do offer payment terms. If our students say, look, Fahim, I can't pay £3,000 up front, I'm happy to pay over the year. We do offer payment terms. If you pay over payment terms, it works out slightly more expensive. With our course plus a university, you are a qualified IP. We cannot issue with an IP qualification. We develop your clinical skills. We can't issue you an IP qualification. You have to go to university for that. But as I've told you, the university courses are not designed to teach you clinical skills. So we do that for you. We organize your doctor. We give you the training. We do all that for you. Would you say do a clinical diploma first? A clinical diploma does not teach you clinical skills. You do not need a clinical diploma. If you are working hospital, it's required to have a clinical diploma. Otherwise, if you're looking to develop your clinical skills, you do not need to do a clinical. Usha, if I was there, I don't know if you would allow me to shake your hands or give you a hug, but I would give you a hug because she's right. I've made that mistake. A clinical diploma does not teach you clinical skills. A clinical diploma will teach you policies, procedures, guidelines, more about looking at healthcare from a different perspective. It is not there to teach you how to diagnose, manage, and treat. Usha has just told you that. In hospital, you need it because that allows you to work at a higher level, policy, procedure, strategy, but it does not teach you clinical skills. So don't make that mistake. If you want to learn clinical skills, I will teach you clinical skills and I will guarantee that you'll be able to use it. And if you can't use it, you can have your money back, and that ain't going to happen. I'm not going to give anybody's money back because we pride ourselves on giving you guys that level of service. So it's not going to happen. So it's not going to happen. But we are developing pharmacists for the future. So that's the thing right there. How do I manage this course part-time with a family? Well, I would say to you, if in terms of Medline courses, if you're willing to dedicate anywhere between 20 to 30 minutes every single day on your learning, you will get results. That's all I'm asking for. 20 to 30 minutes a day, everyday discipline. In a year, you'll get results. If you think that you are going to dedicate 10 years or 10 hours every day studying or 10 hours a week, it can't happen. 20 to 30 minutes, I guarantee that you'll get results. You will be able to, at the end of the 1 year, take a history in every one of those patients who walk through your door. You will be able to document properly. You will be able to examine the body systems. I can guarantee you that. Because we guarantee that, because when you come to our face-to-face classes, we will teach you this. You're going to be able to do that. No doubt. No doubt about that. So, as I mentioned to you, IP course versus doing clinical diploma. Is there funding for community pharmacy? So there is talk about funding for community pharmacy that's been going on for years. Oh, we're going to fund you, we're going to fund you. And then at the end, they said there are limited places. It's not happening today. So if you want to wait around, absolutely you can. That's there. How to strengthen my CV when applying for jobs and how to prepare for interviews. I will be doing, in terms of interviews, remember, people want problems to be solved. If you're going to work in a GP practice, have a look at the CQC report, see where they're struggling. Start to do some part-time work. Develop your clinical skills. So when you do an interview, you can answer their questions. You can say, actually, I'm already can help you with the diagnosis, management, and practice. I can certainly do that. Yes, can I do the IP uni course whilst training with Medline? Yes, you can. You can do both. But I would recommend that you do, if you could do it before, that's good, but doing it together is fine. No problem. But it just means that you need to be more dedicated and committed. But we will help you with exam preparation. We will help you with the whole university course itself. I wouldn't worry about it. I wouldn't worry about it. In terms of strengthening your CV, I love that question, and I'm going to go through it with one of my colleagues who emailed me about this. So apologies if I can't address it in depth. But essentially, what you need to do is you need to start to think, how can I develop myself? So that might involve you working free, doing work experience. That might involve you doing additional courses to develop your service. If you want to work in a GP practice, they're very much interested in helping there with their clinics and their discharge and so on. So you need to get yourselves in there. How early before do we start Medline? So university courses are starting in September. My sincere advice is, please start the Medline courses as early as you can, even 6 months before. Everyone should be starting now. So when it comes time to working with your GP, you can say, Fahim, look, I can take a history. I can do an examination. I can't wait to spend time with my doctor, and now I can apply the skill. A lot of students do everything together and it does become overwhelming. Does that make sense to you? Imagine, right, you started your Medline courses now, and you started to dedicate yourself, you started to learn about history taking, physical examination. Imagine how beautiful that would be when you're with your GP. You can say, doctor, I know this. Explain to me why you're doing this. Because the workbooks that I give you access to if you're doing your IP becomes more sense for you. It makes more sense. Would you say it's better to do the Medline course before or even doing the IP course? That's my thoughts on it. And all of you who are looking to do IP course can't do anything till September now. September is the new courses are opening, not for Medline, but for your university. So you don't have a choice now. You're better off starting earlier and developing yourself. But remember that university applications have opened now. So we've got to get you guys sorted now. The university applications have opened now and they all have deadlines. I just had a student sign up yesterday who's applying at Bath University and the deadline is already approaching for him. So you need to be applying now. Okay. Wow. It's amazing to have now. I'm happy to stay for the next 5 minutes. Fire away any questions you have. Because I know we've gone quite late. It's already 8:14. I don't know why I've got 2 pens. Anybody know why I've got 2 pens? Any questions you have, I'll fire away now and I will answer them. Is there anything I've missed? Is there anything that I've missed that you want me to go through? Did you say you will find us a DMP? Yes, we will find you DMP. Is there a limit on a number of unis you can apply for? No, there is no limit for the unis you can apply for. Would that be local? So your DMP now, the advantage that we do have doctors up and down the country, but with a lot of our courses with our DMP at the moment, they're being done because of COVID via Zoom. So it's not a problem. But our face-to-face classes, we normally do with our clinicians, normally in Oxford itself, but we also are running them in London and Birmingham as well. So if we've got a group of students in one area, absolutely, we can run them in your locality as well, but it depends. Again, Middlesbrough, we will be doing it up north, so we can certainly do that. So someone's asked, is clinical diploma better than being a prescriber? Is clinical diploma better than being a prescriber? And with the new training GPC setting out, do I need necessarily to do the IP course as an already qualified prescriber pharmacist? Does it not make it less relevant? So I'm not sure if you are, what your stage is, but are you a pharmacist or are you a third-year student? But definitely be looking into this. I'm older and qualified. Cheers, mate. Good webinar. What arrangement? So for those who can't pay £3,000 up front, you can pay in 3 monthly installments, or you can do monthly installments. So for monthly installments, it works out to £332 a month over the year, over monthly. So works out to £3,995. But if you say, look, for him, I can't pay £3,000 up front, but I can pay £1,000 now, £1,000 in 2 months, £1,000 for 3 months. Cool, no problem for me. If you are already a gold member of Medline, how much would you charge for? I can discuss that with you separately. We can certainly discuss that. For Medline members, we can certainly discuss that. Tips to get into GP land, improve my C. I'll be doing a separate webinar on that. That's a whole separate webinar. Do you know if community pharmacists from multiples, you have found line managers from the organization? So if your organization doesn't sponsor you, we will sponsor you. So don't worry about the sponsorship. We will organize it all for you, no problem. Medline will act as your sponsor, so it's not a problem. We will do that for you. The whole application side, we will look after for you from start to finish. Nothing to worry about. So yes, as I mentioned, Eleanor, we do organize a DMP, we do everything. Clarify, we will organize it for you. Can you join Medline at any time, or do you run semesters at any time? At any time. You can join any time. Do we organize a DMP? Yes, we do. And how much? Again, it works out to £3,000. if I got my pharmacy diploma from different country, is this acceptable? You need to check with the DMP. You need to check with your GPHC. I'm not too sure if this is acceptable, your pharmacy diploma. You need to, if you're talking about your pharmacy degree, that's separate. But if you're talking about your pharmacy diploma, you need to check with them. Last couple of questions, folks, and I'm about to tune off. How do I sign up? Eleanor, I will, how do we apply to Medline? I will get in contact with you guys and we'll go through it together. So I'll certainly call you. Where is Medline based? Medline itself is based in Oxford. That's where I have my pharmacies, I have my clinic. So you're more than welcome to pop down. It'd be great to see you there. So fantastic. And also you can follow me on LinkedIn. You can follow me in the Pharmacy Business Awards. I write articles there. So please do sign up to my YouTube channel. It'd be great to have you guys sign up to my YouTube channel as Medline. That'd be great. How many times can you take IP exams if you don't pass? There's no reason why you're not going to pass, but I believe you have 2 attempts, but you could redo that exam again. Will this recording be available as I join the meeting late? Yes, I will be in contact with you guys and sign up. Please make sure that all of you, some of you, I hope you've actually registered with your details, because I don't know who you are, but number 825317427, if you can give me who your name is on the chat, that'll be very useful. Eleanor, I think I've got your details, guys. I might have spoken to you. So that Usha, how to join Medline, I will get in contact with you and go through everything. Don't worry, I'll get in contact with you because we're running behind. So I'll do that because I don't want to keep you longer. I just want to wrap up by saying, develop your clinical skills, make a difference to your lives, and be the best versions of yourself. All of you are capable of doing this. Don't give up. So God bless you all. I will certainly, Kenny, please get in touch how to join Medline. I will get in touch. If you sign up to the webinar, I will have your details. I can get in touch. If you haven't signed up to the webinar, I don't know how to get in touch. So for those of you who have signed up to the webinar, your details will appear. I can certainly get in touch with you because you must have received the link, so that's fine. But yes, I'll be getting in touch. So thank you very much for all of this, guys. God bless you all. Have a wonderful evening. Oh, let me leave you my email. Here's my email. Let me write this down. It's fahim@medline.co.uk, or you can get in touch with contact@medline.com. I shouldn't do this. There you go. My wife is always like, why do you give your number? Why do you give your number? But there's my number. It just makes it easier for you guys. So certainly that's my number. Jot it down, write it there, do what you want to do with it. Don't prank call me. Anything but prank call. Don't prank call me. But anything else you want to do, you are more than welcome to. And how do I actually get these? Get this and actually let's put this here. I want to paste this here. Here you go, everyone. Ta-da! If I write this here, I can write my details. There you go. There you go. Everyone's got my details. So that's there. Wow, that has been fantastic. I love you all, and I look forward to working with you all. God bless you all. Thank you very much. And I will be getting in touch. Have a good evening. Take care. Thank you, everyone.